Ласкаво просимо.
Welcome.
Вітаємо всіх учасників. My name is Dr. Natalia Zimak-Zakutnya. I am a director of Khmelnytsky Children's Hospital and a member of OMNI-NET Ukraine. Together with Dr. Sylvia Rozен, Secretary General of the International Federation of Spina Bifida and Hydrocephalus, will moderate for this webinar today. One remarks to all of Ukrainian participants. In case of an air raid, we ask you go to the bomb shelter, but I hope that that evening, unlike the morning, will be calmer. We are gladly pleased to welcome all you here on the introduction event of a brand new series of webinars. Webinars are aimed at healthcare professionals run jointly between European Reference Network for Rare Urogenital Diseases, eUROGEN, OMNI-NET Ukraine, and the International Federation of Spina Bifida and Hydrocephalus, organizations who are absolute leaders and experts in their fields, and thanks to those joint efforts, this series have become possible. And we believe that together we can improve treatment and achieve better results in multidisciplinary care of children with special needs.
Thank you, Dr. Zimak, and I absolutely agree. And with this series of webinars, we aim to facilitate discussions on multidisciplinary care in support of persons with congenital malformations and in particular spinal dysraphisms. And today is a first introduction, and the complete series of webinars offers an exchange of experiences between colleagues both in the European Union and colleagues in Ukraine. And we trust that these webinars can really inspire your work. Please note that for the next webinars with clinical presentations, accreditation will be requested and certificates will be sent after a live attendance and answers provided in the survey after the webinar. And the certificates can be expected about 2 weeks after the webinar presentations. And please, Dr. Zimak, back to you.
Thank you, absolutely. And this is the first webinars we give an introduction to our collaboration fest. It's with great pleasure to introduce you to the 3 speakers today. Professor Wout, Dr. Wout Feitz's, Professor of Pediatric Urology, Department of Urology, Radboud University Medical Center, Nijmegen, Netherlands, Amalia Children's Hospital, ERN EUROGEN Coordinator. Dr. Sylvia Rozen, Secretary General of International Federation of Spina Bifida and Hydrocephalus, Professor Wladimir Вертелецький, Director of OMNI-NET programs in Ukraine, Diplomate, American Academy of Pediatrics, American College of Medical Genetics and Genomics, Corresponding Member, Academy of Medicine, Buenos Aires, Argentina, Academy of Sciences, Ukraine, American Society of Pediatric and Pediatric Research, Doctor Honoris Causa, Kyiv-Mohyl Academy University, and Lviv Medical University, Ukraine. And now we gladly give floor for our esteemed speakers. Welcome.
Dear viewers of this webinar, thank you for joining us, and we hope to explain to you a new initiative of the European Reference Network, ERN-EUROGEN, directed to colleagues, patients and caretakers in Ukraine. In Europe, about 30 million people are living with a rare disease or complex condition, ending up in about 8 to 10% of the whole population. The European Commission has initiated an EU cross-border health initiative directed to patients living with a rare disease. And this European action started in 2016 and is currently funded under the new EU for Health program for the coming years. It is meant to strengthen European cooperation and coordination to improve the access of knowledge, diagnosis, and treatment for patients living with a rare disease. And currently, more than 1,600 specialized centers in almost 400 hospitals of the 28 countries are working together in 24 European reference networks. 24 doctors and their coordination team are working in each specialty area. And for the urological and urogenital diseases and complex conditions, eUROGEN is the directed network. Of course, we are connected with other disease areas like the endocrinology, kidney diseases, cancer diseases, rare congenital malformations, and inherited and congenital anomalies. During the recent years, the 24 ERN coordinators launched a website called Rare Disease Doctors. We are here to help. So this was the first hub, actually, where patients and caretakers, as well as colleagues, could find additional information directed to these networks. Originally, it was coordinated from a hospital in Barcelona. Now, for EUROGEN, to explain a little bit better the ecosystem of the ERNs, it's directed to sharing information on the care and, if possible, improve the cure. Currently, 56 hospitals from 20 European countries are connected within the urological field, and congenital anomalies directed to the urogenital rectal anomalies. For the coming 4 years, different tasks have been directed and guided by the European Commission. It's related to the coordination, to the dissemination and collaboration, the evaluation of the networks and the healthcare providers, and the data and patients we are taking care of. There's a video consulting system on clinical patient management system, which is currently redeveloped to improve a safe and secure and simple system. A registry has been set up with a follow-up time of 25 years, collecting data from the patients as well as from the caretakers, as well as from the doctors involved. There is a special area directed to training and education, where webinars are developed, and they are shown also on our website as well as on YouTube. A special program for new guidelines and clinical decision support tools directed to the rare disease areas is started and is further developed with all stakeholders involved. 2 special items were mentioned in the call of the European Commission, that's capacity building and best practice sharing for the Ukrainian healthcare system. So we will start a dedicated webinar series in 2024. And also in the guidelines, a special section will be included on crisis management in the healthcare system. Other activities will be developed further depending on legal developments and agreements. The coordination involves regular meetings, connection with all stakeholders, governance statutes, documentations, and the coordination team submits the grants. Currently, the network has 3 work streams. The green one is related to congenital anomalies, the orange one to functional urological diseases, and the red one to rare urological tumors. We have supporting partnerships in place with the European Association of Urology, which was involved in the starting of the whole network, the Anorectal Malformation Network, the European Society for Pediatric Urology, ESSEX, and the European Society for Pediatric Surgery. And also individual experts can be supporting partners, as well as specific patient representatives. Most information can be found through our website, as well as on the social media and have a look at the new developments coming up in the coming years. One example is a new book related to the network and the disease areas covered. For the guidelines, registries, data management, analysis, new plans are in place and will be further developed over the coming period. There are special guideline teams working at different areas, as can be seen on the slide, and the registry has been set up. And if you connect with the video, you will have an explanation what's the goal of the registry and how we see this developing in the future. For these guidelines, we work together with the different organizations in Europe, especially the EAU Guideline Office, but also other supporting partners are involved in the developments. One example of a cross-ERN collaboration is the consensus paper published by ERNs, which is the Rare Disease Kidney Disease Network in place. In this way, we try to avoid double actions and double work and direct the new guidelines to specific care and treatment and outcome for patients living with a rare disease. In 2021, we started with regular webinars presented by experts in the field, sometimes on loan or sometimes with others involved in the same webinar. These can all be found through our website as well as the YouTube channel directed to ERN eUROGEN. In these webinars, there's shared vision of the experts who work in the different hospitals, as well as in the future, new guidelines and clinical decision support tools will be presented in this way. We try to connect the patient's needs and the patient journeys with these kind of webinars, where we can present, say, the common needs of patients with uncommon conditions. With the EAU, recently a patient video has been launched on penile cancer. These are examples on how we can share the information currently available. Like I said, with the Ukrainian crisis developing, the doctors involved and the medical teams involved in the care for patients with a rare disease was originally directed through a hub in Barcelona. But in the current situation, Ukraine has developed a national hub for patients living with a rare disease, and this is supported to a new EU initiative, which is called the Joint Action for the Integration of ERNs in the healthcare systems. So please pay attention to this, and if you need help, try and find it in the best way possible. Thank you very much for your attention, and we'll go on to the next page of the webinars, explaining the steps which will be taken into 2024. Thank you very much.
Welcome, and it is really a great pleasure to see you all here. My name is Sylvia Rosen. I'm the Secretary General of the International Federation for Spina Bifida and Hydrocephalus. And with this virtual webinar, we really aim to facilitate discussions among healthcare professionals between Europe and Ukraine in the support of patients with often rare and complex conditions such as spina bifida. And as an introduction in this presentation, I will underline the importance of multi-stakeholder engagement to support person-centered health outcomes. And together, we have an important role to engage multi-stakeholders to realize health outcomes, in particular prevention and optimizing management and care for persons with spina bifida and or hydrocephalus, as well as their families. As an introduction to the International Federation, you see here an overview of who we represent. In our network, we have spina bifida hydrocephalus associations in over 95 countries around the world. and all have unique and expert knowledge on what it is to live with this complex condition, but also what it is to advocate for the human rights. And as we always would like to say, each one of us can make a difference, but together we can make change. And that's why we like also to focus on the partnerships that we can have to be stronger together. Today, it is, of course, an important start of a series of webinars where we, together with you, reflect also on the important aspects of healthcare, and in particular, multidisciplinary healthcare for people with rare and often complex conditions such as spina bifida. But it is also about the actions that we can take together to really make a difference in the upcoming years in terms of early detection, optimizing management and integrated care, as well as the prevention measures. One of the primary missions of us as International Federation is the advancement and full realization of the human rights of individuals with spina bifida and hydrocephalus as per the international human rights law. And as you can see here, the United Nations Convention on the Rights of Persons with Disabilities is the most important international treaty for the global community for persons with disabilities. And the right to the enjoyment of the highest attainable standard of health without the discrimination of the basis of a disability is enshrined in Article 25 of this United Nations Convention. And this includes providing health services needed to minimize and prevent further disabilities. Now, the European Union published a Europe strategy for the rights of persons with disabilities 2 years ago, as you can see here on the right. And in this strategy, several flagship initiatives were shared, including the disability platform. And the disability platform is shared by the European Commission, and it's composed of representatives from all 27 member states of the European Union and 14 civil society organizations. And we as International Federation are one of the 14 civil society organizations. And taking part in this European Commission Disability Platform is an example why it's so important to form a network, because for us it enables persons with disabilities to have an impact on policy development from the beginning, and also helping to create inclusive policies and legislative initiatives within and beyond the European Union. Now, the meeting today is a great example, because as a state party to the convention, the member states, you as healthcare professionals, but also as the representative patient organizations, we together can really inspire to respect and implement these principles. And I have the full confidence that together with you as an important advocate, as important advocates here today and in the following series of webinars, that this will be successful. Here you see some of the aspects of our work, and raising awareness on the priorities of our global spina bifida hydrocephalus communities to policymakers is very important, because we require multidisciplinary care to be considered in the context of disability rights. But of course, we work with more stakeholders. And the way we work, we apply different strategies such as advocacy, raising awareness, community building, human rights education, research, and support to our members. The collaboration with you in this is very important, because it is about the perspective of developing integrated approaches in health, as well as research together with patient and other professional organizations for the prevention, as well as optimizing management and care. On the right picture, you see there are several types of neurotube defects, all indicating forms of birth defects that can occur during the developmental stages of the fetus or the unborn baby. And the most common form of neurotube defect is spina bifida. as well as anencephaly. And babies born with spina bifida may also get hydrocephalus. But most probably, you know this already. This is not new to you. But what is important to look at and remember is that these conditions are often preventable. And the initial management has a profound effect on survival and the extent of disabilities that persons with spina bifida and hydrocephalus may suffer. Also, early intervention and support are crucial for improving a meaningful life, and this requires a multidisciplinary care team of healthcare professionals. And of course, when one thinks about care, when one thinks about different aspects relevant to the community, such as persons with spina bifida and hydrocephalus, the different aspects come across. As Erasmus always likes to say, festina lenti, hasten slowly. Think, what is the priority where you are, and what is the priority for you, what is the priority for the patient, and what it is that you can work on together. So when you zoom in on a health problem, one sees very quickly the challenge is rather multifaceted, and that requires a multi-stakeholder perspective. Here you see in the upper line the prevalence rate of spina bifida in Ukraine compared to Europe. And the data shows a persistent difference, and in current circumstances, I'm afraid it will remain an epidemic in need of prevention. And Professor Wertelecki already shared with us some updates on that, but also the perspectives around what it is that we can do. And unfortunately now for the Ukraine, we have to deal with a complete other situation, but we are actively involved with countries worldwide to reduce the prevalence rates and promote the legislation of mandatory flower fortification. Prevention, as you can see here in the quote of the Nature briefing, is of course key. If you wait until after birth or long time after birth, you will miss an opportunity to prevent irreversible pathology. And that's what we are looking at when it comes to prevention. The word, according to the dictionary, means the act of stopping something from happening or arising. But what do you want to stop in the first place? On one way to think about this is in terms of primary prevention through folic acid fortification. And on the other side, secondary and tertiary prevention are aimed at individuals with spina bifida and hydrocephalus, where early detection and follow-up can minimize comorbidities and can improve quality of life. Now, here you see a young boy. He looks happy. In this case, the surgery looked good, and he has a considerate positive quality of life. But we must not forget that when we speak about spina bifida, it is one of the most common visible detectable malformations at birth. And this addresses both a health and economic issue, one of the very few we actually know how to prevent. And here you see that in the data shows that such anomalies can be prevented 72% of the cases. And in order to think about prevention, we like to think about fortification because it is the most evidence-based, cost-effective policy. And this already is implemented in very effective ways and also safely in countries around the world. And this year in particularly, we see an opportunity and a global momentum for large-scale food fortification. We have already been involved and really a vocal proponent for large-scale food fortification with folic acid for decades. And as part of that advocacy, we have been working with partners for the past years to bring a strong resolution on food fortification for reducing the prevalence of neurotube defects towards the World Health Organization. And the approval of the World Health Organization Executive Board was this year an immense milestone in achieving our goal. And this could certainly not have been possible without the collaborations that we have with our members and partners, because together we really are a global advocacy community. And the advancement on the international level cannot be achieved without progress on local and national level as well. A particular highlight was also the Lancet publication that you see on the left, and of course the celebration of our Global World Health Assembly resolution, as you see on the right. If one thinks about prevention, you cannot exclude at the same time care. Because if we think about the basics, it is in fact the leading principle of our efforts, which is simple. It is to assist a person with disability into a person with ability, as well as their involved families. And I can give you many examples, and I will share with you two recent examples, one from our international youth group, and second from our working group on aging. And here you see the recent work of our international youth group. We have currently 13 young persons in the youth group represented, whereby Catherine, you see here, Katarina on the right, she represents also our member association in Ukraine. Now this year, the youth mentioned to us, we find it important that we have access to independent living. And therefore, based on this theme, they made a statement, they run awareness campaigns, and also served as speakers in online and international meetings, such as the United Nations meeting for state parties, which is the UN CUSP. And the youth also organizes different webinars to talk about what it is that independent living requires. And especially it's stimulating to see how the youth interacts with one another. And the same goes for the working group on aging. This group now consists of 8 people around the world of the age of 35 years and older. And a particular highlight was that the working group developed not only a survey, but also a report that served as best practices of our associations who all work on strengthening the aging community in terms of activities that can be of support to the community. Now, their work was also well noticed at international meetings and at the conference we recently organized. And one of the important remarks that the aging community shares with us is that they want to be seen as a person, not as a patient. And also mental health is being seen as an important topic. And they really want to grow older while ensuring their quality of life. And that requires the support of a multidisciplinary care team. To further advance our advocacy work, you see here examples of other international days where we are active to support our global community. And one of the, in particular, very inspiring day is the If Siblings Day, where siblings show how they perceive it to have a sibling with a disability, but also what one can do to support. And again, it is about the exchange of experiences and also to stimulate each other in the work going forward that makes these international days worthwhile. Another important activity is the exchange of knowledge and expertise. And previous year, we organized the 29th International Conference on Spina Bifida and Hydrocephalus, where our members voted for the theme, Diverse Needs, Same Rights. And together with the conference scientific committee, we created an ambitious program with speakers from all over the world, but also in a total of 43 talks. And we had 10 sessions with different topics covering the diverse needs and same rights for our global SBH community. And in particular, we had a keynote lecture presented by Professor Wertelecki as Director of the OMNI-NET in Ukraine, and Diana as the Head of Information and Analytics for Project and Data Manager of OMNI-NET, and also part of our EuroLink-at collaboration. And the ERN Ithaca and EUROGEN collaboration. And in this keynote lecture, activities were shared from the collaboration that OMNI-NET has with a consortium of over 20 children's hospitals in Ukraine, but also with administrations and medical facilities, medical universities and public organizations to improve awareness, birth defects monitoring, the research, improve diagnosis and prevention, and develop strategies of early intervention and medical care in the Ukraine. And this conference facilitated further discussions on prevention and care. And by sharing also your experiences from Ukraine in this meeting, your work inspired also the participants from all around the world. Another example of activities where we stimulate the knowledge exchange and twinning between countries, you see here on the left, the United Nations meeting on the rights of persons with disabilities, and as well as the World Spina Bifida and Hydrocephalus Day, for which we held a conference and different side events, regional meetings throughout the month of October this year. And next year, we organize the 30th International Conference on Spina Bifida and Hydrocephalus. And these are important meetings to exchange clinical care expertise, also research knowledge, as well as practices. There is a dynamic interaction between multi-stakeholders. And in a previous presentation, you already learned about the European reference networks, for example. And within this network, there's an important relation between healthcare providers and patient representatives. The network facilitates discussions on rare disorders, and in particular for Spina Bifida, we have a working group on Spina Bifida and other dysraphisms. Now, this working group is unique, and from the start, we have worked closely together in prioritizing key actions for our work. And the work includes, for example, guidelines on urological management, an important topic for our community. And another key activity is the exchange of knowledge and strengthening collaborations throughout the region. And given the important need for multidisciplinary care work, we also work across ERNs. For example, our collaboration today with the ERN EUROGEN. And we are very happy that through our collaboration, we can inspire the work between Europe and Ukraine. And the current webinar and upcoming webinar series are therefore a starting point, which is important. We trust that you find this webinar series on spinal dysraphisms also useful, and we look forward to fruitful discussions today and also later. And here you see the agenda of the upcoming webinar series, which you also receive further details on. And let me close with a slide again, and the phrase we commonly use, that each one of us can make a difference, but together we can make change. And I look very much forward to our fruitful dialogues now and in the near future. Thank you.
Greetings. It's a pleasure to participate in this precedent-setting meeting. I represent OMNI-NET programs in Ukraine, and here are shown several links. I don't expect people to copy them, but since this is a recording, you can do so later. Among the functions of OMNI-NET is the sponsorship of webinars. As for myself, you can find my background in the link at the bottom. The fundamental role of OMNI-NET programs in Ukraine is to serve as a catalyst, and here are shown some of the icons of our principal partners, including the International Federation of Spina Bifida. We have interesting collaboration with Reaper Talks. We created a website that presents information on all the teratogenic agents sold by the pharmaceuticals in Ukraine. Another emphasis is on alcohol, in collaboration with the National Institutes of Health, concerning the fetal alcohol spectrum disorders and so forth. We have been working in Ukraine since 2000. Here's a map. And our programs are centered into 3 provinces, 2 blues and 1 green, and with connections to healthcare centers across the country. We are the only program from an area of the former Soviet Union that is monitoring birth defects utilizing international standards. That qualified us to be a members of EUROCAT. EUROCAT is a European surveillance network of population-based congenital malformation monitoring. A sister organization is an international clearinghouse of birth defects. We are members of both. About 10 years ago, EUROCAT became integrated with the European Commission programs and is represented in the EU Science Hub Joint Research Center located in Ispra, Italy. With the war, obviously, we have lost contact with much of the eastern Ukraine as well as with Crimea. We are conducting population birth surveillance across several provinces, and we are going to focus on one called Rivne because it has been contaminated by Chernobyl. The upper north half is heavily polluted. The lower half is considered to be not polluted, and you see rivers and areas. But the point is that the population-based surveillance shows a chronic persistent epidemic of Spina Bifida, and the question arises, is this due to radiation? Here you see measurements of incorporated cesium by pregnant women. Over 10,000 measurements were conducted. You could see in red that there is a temporal decrement of the concentrations of cesium in the bodies of pregnant women, suggestive that there is a temporal decay of the radioactivity of cesium. In green, you have a control area. There is absolutely no doubt in our mind that we have 2 areas, one contaminated and one not contaminated, directly measured in the body of pregnant women. Therefore, their levels are impacting every conceived fetus since conception to birth. In red, you see the polluted areas, and in the upper 2 graphs, you see that the NTD or Spina Bifida prevalence rates per 10,000 births in the red zone is statistically significantly greater, and you see a temporal decrement, and in green, you see the non-polluted area. Below, you have 2 periods of time, and again, it shows the same. This has been the core of our efforts in the science mode. But war is war. We are physicians, and physicians are humanitarian. We are helping children with Spina Bifida by distributing urinary catheters, and we are trying to distribute cerebral shunts, which poses a much greater challenge because of the price. This is the distribution center A, and on the left, upper left, you see Diana holding a box. She's the coordinator of our partnership with EUROGEN. In another distribution center, and there can be many like it, we can clone them because we have a network of children's hospitals to work with. But providing care without providing prevention is incomplete. So we are distributing folic acid tablets along the way because every mother of every NTD child is a high-risk individual, and she should know that she can prevent or lower her risk of having another baby with neural tube defects. War is war. Every penny helps. We invite professionals to be our partners. But it's hard for us to limit what we do exclusively to neural tube defects. These girls sitting in the wheelchairs are not wheelchair bound because of neural tube defects. They are wheelchair bound because of Mr. Putin. We have to help them. So please help us to help them. Become our partner. Every penny helps. You can do so by direct contributions to this website, which then in turn transfer the funds to OMNI-NET. Many charitable organizations help directly. We are a catalyst. Help us to help them because we know where the needs are and we have a platform that can do so effectively. By not helping us means we cannot help them. Thank you for your attention.
Thank you to our speakers for giving the introduction and the outline of their activities and for making this webinar series possible.
Yeah, the series of webinars is about partnership and what we can do together to inform a fruitful exchange of knowledge and expertise between both EU and Ukraine. And therefore, this first webinar really is a starting point to further stimulate the exchange of knowledge and expertise of colleagues in both nations. And we very much look forward to seeing you in the upcoming webinars and invite you to the next meeting on December 14th on multidisciplinary management of spina bifida.
And your participation is important. We encourage you all to take an active participation. До побачення.
Absolutely. And should you have comments or questions, then don't hesitate to be in touch following the contact points here visible on this slide. And for now, looking forward to seeing you soon on December 14th and of course during the clinical presentations that follow in 2024.
Дякуємо, до побачення.